Everyone, and welcome to Crohn's Well Nest. Today, we're diving into a topic that affects millions of people worldwide: gout. It's not just a medieval ailment reserved for kings. Gout can strike anyone, and the pain it brings is no joke. But fear not, because in this video, we're going to explore what gout is, what causes it, how rheumatologists diagnose gout, risk factors, and most importantly, gout prevention strategies on how you can avoid those excruciating flare-ups. Stick around until the end, because we'll be sharing some practical tips and lifestyle changes that can make a world of difference. So, let's get started. First things first, what is gout? Gout is a type of inflammatory arthritis that typically presents with sudden and severe attacks of pain, redness, and swelling in the joints, often in the big toe. It's caused by the accumulation of uric acid crystals in the joints, which can be extremely painful. How does the rise in blood urates elicit gout? Though it is considered a rapid illness, it is not a disease which develops suddenly with the rise in blood urates. Nevertheless, when the level of uric acid gets disturbed, particularly when it is elevated, the chances of rapid onset is more common. As said earlier, the excessive uric acid in the blood tends to get precipitated and deposited in the joints. This deposition in the joints triggers the body's immune response in the form of an inflammatory reaction, calling in the macrophages. This inflammatory response continues as a chain reaction, drawing in more WBCs, and worsening the inflammation. The excessive protein production at the site lowers the pH, making it favorable for uric acid crystallization. Hence, the situation becomes worse, resulting in unbearably painful gout attacks to the patient. Now, let's talk about what causes gout. It's essential to understand clearly the root causes. Uric acid is a waste product that is normally filtered out by the kidneys and eliminated through urine. However, when there's an overproduction of uric acid or the kidneys can't remove it efficiently, it can build up in the bloodstream, leading to gout. Certain risk factors, such as genetics, diet, and lifestyle choices, can contribute to this. The journey to a gout diagnosis begins with a clinical evaluation. You'll sit down with your healthcare provider, who will ask you about your medical history and your symptoms. They might inquire about past joint pain episodes, the affected joints, and your family history. Next up, the physical examination. Your healthcare provider will inspect the affected joint or joints for signs of inflammation. Redness, warmth, swelling, and extreme tenderness are common indicators of gout. Gout typically targets one joint at a time, most often the big toe. For a definitive diagnosis, your doctor might recommend a joint aspiration or synovial fluid analysis. This involves drawing a sample of synovial fluid from the affected joint using a needle. Synovial fluid is the lubricating fluid found within joints. The critical step here is the microscopic check. The synovial fluid sample is examined under a microscope to identify uric acid crystals. These crystals appear as tiny, needle-shaped structures, and they are negatively birefringent, meaning they shine brightly under polarized light. Blood tests are another essential component of the diagnosis process. A healthcare provider may order blood tests to measure uric acid levels. However, it's important to note that elevated uric acid levels are not an exclusive indicator of gout. In some cases, your healthcare provider might recommend imaging studies like X-rays, ultrasounds, or MRI scans. These help to assess joint damage and rule out other potential causes of joint pain and inflammation. The medical world isn't always straightforward, and conditions can sometimes mimic each other. Healthcare providers consider a differential diagnosis, exploring other potential conditions that might have similar symptoms to ensure the correct diagnosis. But why do some people get gout while others don't? It all comes down to risk factors. First on our list are genetic factors. While gout isn't entirely hereditary, it can run in families. If you have a family history of gout, your risk of developing the condition may be higher. Your diet and lifestyle choices play a significant role in gout risk. Some dietary factors to watch out for include: the consumption of high purine foods can increase uric acid levels in the body. Foods such as red meat, organ meats, seafood especially shellfish, and certain types of alcohol especially beer are high in purines and can contribute to gout development or exacerbate the condition. Lifestyle choices such as excessive alcohol consumption, especially beer, can elevate uric acid levels. Dehydration, which can result from alcohol consumption, can also increase the risk of gout. Another significant risk factor is obesity. Extra body weight can lead to higher uric acid levels and reduced excretion by the kidneys, making it more likely for uric acid crystals to form in the joints. Certain medications can also increase your risk of gout. Diuretics, often used to treat high blood pressure and heart conditions, can raise uric acid levels. Low-dose aspirin is another medication that might contribute to gout. If you have underlying health conditions like high blood pressure, diabetes, kidney disease, or metabolic syndrome, your risk of gout may be elevated. These conditions can affect the body's ability to regulate uric acid levels. Gout tends to affect men more than women. However, women's risk of gout increases after menopause. It's also more likely to develop as people get older. Understanding the risk factors for gout is the first step in preventing this painful condition. By making informed choices about your diet, lifestyle, and health management, you can reduce your risk of gout. It's important to note that not everyone with elevated uric acid levels will develop gout, and not everyone with gout has the same risk factors. Gout is a complex condition influenced by multiple factors. If you or someone you know is dealing with gout, you should avoid high-purine food to keep those joints pain-free. High-purine foods are a big no-no. These include red meat, organ meats, shellfish, and certain types of fish like mackerel and sardines. High-purine foods, such as red meat, organ meats, seafood, and certain alcoholic beverages, are rich in purines. When the body breaks down purines, it produces uric acid. Consuming these foods can lead to an excessive production of uric acid, raising uric acid levels in the blood. Elevated uric acid levels can result in the formation of uric acid crystals. These crystals can accumulate in the joints, leading to inflammation and severe pain during gout attacks. Regular consumption of high-purine foods can trigger gout flare-ups, characterized by sudden and intense joint pain, redness, and swelling. Consistently consuming high-purine foods and alcohol can contribute to the progression of gout, making it more frequent and severe over time. Be cautious of high-fructose foods and drinks, such as sugary soft drinks. They can increase uric acid production, so it's best to limit them in your diet. Processed and fast foods are often high in unhealthy fats, sugars, and salt. These can contribute to weight gain, another risk factor for gout. Limit your intake of fried foods, sugary snacks, and processed meals. High-sodium foods can exacerbate gout symptoms. Now, let's get to the good part: how to avoid gout. Here are some key strategies you can implement in your life. Number 1. Hydration. Stay hydrated. Drinking plenty of water helps dilute uric acid and promotes its excretion. Number 2. Balanced diet. Opt for a balanced diet rich in vegetables, whole grains, and fruits. Cherries, in particular, have shown to help lower uric acid levels. Number 3. Limit alcohol. If you consume alcohol, do so in moderation. Beer, in particular, has been linked to higher gout risk. Number 4. Exercise. Regular physical activity can help maintain a healthy weight and reduce the risk of gout. Number 5. Medication. If you've had gout attacks or have high uric acid levels, talk to your doctor about medications that can help manage uric acid levels. In conclusion, gout can be a painful condition, but by understanding its causes and taking preventive measures, you can significantly reduce your risk of experiencing gout attacks. Remember, it's crucial to consult with a healthcare professional for a personalized plan tailored to your specific needs. If you found this video helpful, please give it a thumbs up and share it with anyone who might benefit from this information. And don't forget to subscribe for more informative content on health and wellness tips. Thank you for watching, and we'll see you in the next video.